It is my great honor to use the Stanley Plotkin gavel to open this meeting.
It's our good friend and colleague, Dr. Stan Plotkin.
Dr. Plotkin.
Virtually every country in the world is affected by his vaccines.
He was involved in pivotal trials on anthrax, oral polio, rabies vaccine,
Rubella vaccine, the rotavirus vaccine, rabies.
He has earned the Distinguished Physician Award of the Pediatric Infectious Disease Society, the Finland Award of the National Foundation for Infectious Diseases, the Hilleman Award of the American Society for Microbiology, the French Legion of Honor, and the Bruce Medal in Preventive Medicine.
He's a member of the Institute of Medicine and the French Academy of Medicine.
One of the very special things about him is the global impact that he's had, not just from the products, but from his book.
He developed the standard textbook for vaccines in 1988.
Bill Gates calls his book a Bible for vaccinologists.
I hope you all have indeed have read the book, and I hope it's more accurate than the Bible.
He trained just a generation of scientists, including myself, to think like he thinks.
Earlier, you testified that there are two Hep B vaccines in the market, one by Glaxo, GSK, that's Engerix B, and the other one is by Merck, Recombavax HB, right?
Yes.
This is the product, the manufacturer insert for Recombavax HB, correct?
Yes.
And the clinical trial experience would be found in section 6.1, correct? Correct? Dr. Plotkin?
Yes.
Okay. In section 6.1, when you look at the clinical trials that were done pre-licensure for Recombavax HB, how long does it say that safety was monitored after each dose?
Let's see. Uh, 5 days.
Is 5 days long enough to detect an autoimmune issue that arises after 5 days?
No.
Is 5 days long enough to detect any neurological disorder that arose from the vaccine after 5 days?
No.
There is no control group, correct?
It does not mention any control group, no.
No. If you turn to section 6.2, under immune system disorders, does it say that there were reports of hypersensitive reactions, including anaphylactoid reactions, bronchospasms, and urticaria having been reported within the first few hours after vaccination?
Yes.
Have there been reports of hypersensitivity syndrome?
Yes, that's what it states.
Does it reports of arthritis?
It is mentioned.
Okay. It also reports autoimmune diseases, including systemic lupus, erythematosus, lupus-like syndrome, vasculitis, and polyarteritis nodosa as well, correct?
Yes, that's what it states.
And also it states that under the nervous system disorders, it states that there have been reports of Guillain-Barré syndrome, correct?
Yes.
As well as multiple sclerosis, exacerbation of multiple sclerosis, myelitis, including transverse myelitis, seizure, febrile seizure, peripheral neuropathy, including Bell's palsy, radiculopathy. Thank you very much. Muscle weakness, hypothesia, and encephalitis, correct?
Correct.
These are events that are reported after vaccination, and as we've just discussed, in order to establish whether it's causal between the vaccine and the condition, you need a randomized, placebo-controlled study. But
yes.
That was not done for this hepatitis B vaccine before licensure, was it?
No.
Okay. And given that the vaccine now appears on the CDC's recommended list, isn't it true that it would now be considered unethical to conduct such a study today?
It would be, yes, it would be ethically difficult.
About this.
This is an excerpt from the...
And this is, I'm asking him about the IOM report I just showed you.
This is an excerpt from the IOM's report, right?
Yes.
Okay. Can you read the causality conclusion with regard to whether DTaP and Tdap cause autism?
The evidence is inadequate to accept or reject a causal relationship between diphtheria toxoid, tetanus toxoid, or acellular pertussis containing vaccine and autism.
If you don't know whether DTaP or Tdap cause autism, shouldn't you wait until you do know, until you have the science to support it, to then say that vaccines do not cause autism?
Do I wait? No, I do not wait, because I have to take into account the health of the child.
And so for that reason, you're okay with telling the parent that DTaP, Tdap does not cause autism, even though the science isn't there yet to support that claim?
Absolutely.
According to your profile, you have done most of the pivotal trials relied upon to license many of the vaccines, correct, on the market?
Yes, sir.
Okay. So you're highly experienced at conducting clinical trials, correct?
I'm highly experienced conducting clinical trials.
Okay. And you're familiar with many of the clinical trials that relied upon to license many of the vaccines currently on the market, correct?
I am.
In your opinion, did the clinical trials relied upon to license the vaccines that Yates received, many of which are still on the market today, were they designed to rule out that the vaccine causes autism?
No. You've badgered me into answering the question the way you want me to, but I think that that's probably the answer.
Is that your accurate and truthful testimony?
Yes.
In the expert disclosures for this case, it asserts that, among other things, you will testify that, quote, the issue of whether vaccines cause autism has been thoroughly researched and rejected, end quote. It's your testimony that MMR vaccine cannot cause autism.
That's correct.
It's your testimony that Hep B vaccine cannot cause autism.
That's correct.
It's your testimony that IPOL cannot cause autism.
Yes.
It's your testimony that HIV vaccine cannot cause autism.
Yes.
It's your testimony that varicella vaccine cannot cause autism.
Yes.
It's your testimony that Prevnar vaccine cannot cause autism.
Yes.
And it's your testimony that DTaP vaccine cannot cause autism.
Yes.
And do you have a study that supports that DTaP doesn't cause autism?
I do not have a study that DTaP causes autism. So I don't have either.
Do you have any study one way or another of whether IPOL causes autism?
No, I do not, sir.
Do you have any study one way or another of whether NGRX B causes autism?
I do not have any evidence that it causes autism, nor that it does not.
And what about Hib titers vaccine? Any evidence one way or another of whether it causes autism?
No.
And what about Prevnar vaccine? Any evidence one way or another?
No, sir. No, sir.
And how about varicella vaccine? Let me just finish. Are there any studies one way or another that support whether it does or doesn't cause autism?
Part of MMR, but not as varicella by itself. No, sir. No studies that say it does, or no studies that say it doesn't.
Right. There have been studies that have found an association between hepatitis B vaccine and autism, correct?
Not studies that I feel are credible.
Okay, which study are you referring to when you say that?
Well, why don't you show me the study, and then I'll see whether I agree with it.
So hold on a second. I didn't do it. She did it, honestly. I just asked questions. So there's what the public health authorities tell you when they're putting stuff on websites and they're on CNN or they're publishing stuff. And then there's what they say when they're under oath, and they're very different. They tell you vaccines do not cause autism. You don't even need to. You're a parent. It's not your job to prove the vaccines are not safe. It's their job to show you that it is safe. They have not done that. And if they haven't done it for autism, the thing that they say they've studied more than anything, what do you think they've done for the other 100 serious adverse events that are listed on the package inserts that the manufacturers say they have a causal reason to believe might be related?